So I'll probably answer first aspect, inflammation. Uh, I'm just going to focus on pulmonary hypertension. I'll have Dr. Chen and Konetti talk about cancer. So there's so much evidence now suggesting that inflammation plays a critical role in this type of heart disease called pulmonary arterial hypertension. And we initially, 20 years ago, thought that, hey, this is as a cause of the disease, and it's actually not, like, it's a result of the disease. It's a consequence rather than a cause. But human research and animal research have shown that inflammation actually indeed plays a role. But inflammation can be from many different factors. And what we think is one of the factors is the gut microbiome. So if we can make the gut microbiome healthy, we reduce the inflammation. So we are putting, like, we just decrease the fire. Now, second question, like, how does the gut microbiome relates to inflammation? By if you have an abnormal gut microbiome, your gut gets leaky. So all the bad bacteria from the gut, which generally won't get into your blood, gets into the blood and then stimulates your immune system. And then these immune cells secrete these abnormal proteins called cytokines, which can make the blood vessels grow. Okay, 2. 3. When we do a microbiota transplant, do we completely replace the patient's bacteria? It varies. Sometimes in some diseases, what we do is for microbiota transplant, like, the native patient's bacteria always fight, and whatever we give is not taken up. The healthy bacteria is not taken up. So in some diseases, right now what's being studied is we purposefully give an antibiotic for a week. That antibiotic will destroy all the unhealthy bacteria they have. Then following that, we give the healthy bacteria. So all the healthy bacteria we give then is taken up by the recipient. So if we just give the unhealthy bacteria alone, not all of them are taken by the recipient. But if you give an antibiotic pre-treatment followed by the microbiota transplant, then we get a higher number in them. So there are different protocols. It depends on the underlying disease that, the protocol varies.